My name is Isabel Sofia Dieppa, pronouns she, her, hers, and I am the engagement reporter at the Fresno Bee Education Lab. The Ed Lab, as we like to call it, includes 3 reporters and 1 editor. We are a community-funded reporting lab based out of the Fresno Bee, and we work on education stories with a focus on education attainment and solutions journalism. You can find us at fresnobee.com/edlab. The coronavirus pandemic has completely disrupted our lives. Many students have been distance learning for almost a year. During the fall, some districts were able to obtain permits for K-6 students to attend classes on campus at least part-time. The number of COVID-19 cases over the past month, combined with the limited availability of our ICU beds in hospitals, has many community members concerned about whether school openings will cause a wider spread of the virus. We have invited you all to submit your questions and concerns about future school openings for our invited guests. If you are not able to submit a question, not to worry. We will also be taking some questions live. If you want to submit a question, be sure to leave it in the comments. Without further ado, I'll introduce you to our panel. We have Dr. Emerald Farrell, Superintendent of Clovis Unified Schools, Hank Gutierrez, Deputy Superintendent for the Fresno County Superintendent of Schools, David Lucchini at the Fresno County Health Department, and Dr. John Zweifer, a physician at the Fresno County Health Department, and our very own K-12 reporter, Monica Velez. Thank you so much, everybody, for participating.
Thanks for having us.
You're welcome.
Let's get to it. Our first topic is COVID-19 and contact tracing on school campuses. Monica recently reported on the rising number of positive COVID-19 cases on school campuses. I'm now going to shift it to Monica to ask a couple of questions she has based on her reporting. Take it away, Monica.
Thank you so much, Isabel. So the first question is for Dr. Zweifler. I've reported on the number of positive COVID-19 cases at the 4 major school districts in Fresno County. So that would be Fresno, Clovis, Central, and Sanger Unified. I found that the campuses that have brought students back like Clovis and Sanger have reported more cases than Fresno and Central, which are still closed. How much impact do positive COVID-19 cases on campuses have on community spread? Is this something that is being tracked?
Well, we have been keeping close track of the number of cases on campus, not only through the reports from the schools of individuals who are positive, but also we've been doing surveillance testing with the schools. So we've been doing surveillance testing of staff, about 10% twice a month, to give us a sense of whether there's increasing numbers of cases that are out there. Let's just back up for a second and talk about what is it what would be considered a close contact and when you're talking about contact tracing. So someone is considered a close contact if they're within 6 feet for 15 minutes or more of someone who is in their infectious period. So the infectious period is 2 days before when you test positive if you're asymptomatic, or 2 days before your symptoms start if you're symptomatic, up to the isolation period, which is 10 days. So if you're in contact with someone over a 24-hour period for at least 15 minutes who is infectious, then that would be considered a close contact. And so we really focus on that. So it's inevitable when you have spread in the community that you're going to find some students and some staff who have COVID. And we've set up processes with our school partners to really check for this. So if you're going on campus, you're going to be screened for COVID. So you're asked if you've got fever, cough, runny nose, GI symptoms. Headaches are all symptoms that are related to COVID. So you're asked about that prior to coming on campus. And if you have those, you're asked to leave, or to even better, to not show up in the first place. So we've set up processes to reduce the number of individuals who are going to arrive on campus who are positive. But really the issue is there spread that's occurring in the schools? And what we have found is that we really have seen no incidences where there has been transmission from students to other students or from students to teachers during this pandemic period. And so we're really happy about all the steps that our school partners have taken to make sure that the schools are as safe as possible. There has been an incident where there was a transmission from staff, and it just points out that we need to really follow all of our basic protocols. So that means the two most important: wearing your mask and maintaining social distance at least 6 feet apart. Our schools, when they opened, we had them. We really focused on the social distancing, small cohorts, having groups less than 15 or less, focusing on hybrid models so that you didn't have to overload the classes. And I think that's the reason why we really have not seen transmission in the schools to date. To me, it's really been a success story so far. But you have to put this in the overall context of where we are, and I think there's three big factors. One of them is this surge, which has been it has been the biggest surge that we've seen. COVID, for all of you out there, is very real. 400,000 Americans have died from COVID. And in a normal year, 2.8 million people died. Even if you don't believe in COVID, 3.2 million Americans died this last year. And the reason for that is COVID. In Fresno County, we were seeing 20 people a day die from COVID. David Lucchini and I were speaking to our infectious disease specialist the other day. She was explaining to us that last year, the number of deaths from flu was 23. We had that many deaths in one day from COVID. This is very real. We absolutely need to take steps to address it. We've been working closely with our school partners to help them so they can open because health is not just limited to COVID, but it's also, there's a lot of other aspects to ensure that our children are healthy. Their psychosocial growth is important to us as well. I guess that was a long-winded answer to your question, so I'll stop there.
If I could just add a couple of things about contact tracing. This is David. We created over the summer an academic setting medical investigation team that comprises a lot of communicable disease specialists that work very closely with the schools. So when you mentioned about the schools had submitted waivers to open up, one of the requirements, they had to provide a name of who this team can work with when there are cases identified. And so they work very close together to kind of talk about contact tracing and where to go from there and see how many cases are occurring on the campuses and provide guidance. This team has not had to make a recommendation of closing a school or anything like that. There have been a couple of schools who've decided on their own that just to be safe, will close a classroom or a school. But otherwise, it's been great to have this communication. This team, the leader of this team, works regularly with us weekly as we meet with school nursing leaders. So we're always trying to be on the same page. I think that's what gives a great advantage here, at least in Fresno County, where we work continuously together with the schools, representatives from the schools, the superintendents, so that we're always on the same page. Because as you know, over the past several months, things can change, guidance can change. And so we always need to be always on that same page if we're going to be very effective on this stuff.
Thank you so much for that information, David and Dr. Zweifler. So this is another question for the health department on behalf of Erica Ireland. What is the timeline for when children can start receiving the vaccine?
Well, we know the vaccine, for one vaccine, it's approved for 16 and older. That's the Pfizer. The Moderna is 18 and older. From there, Dr. Zweifler, I've not seen a timeline. I think they were just starting studies with younger ages. Dr. Zweifler? Okay.
Yeah, so with children, so a couple things to keep in mind. So first of all, with kids, they do get COVID. They can transmit COVID, but neither of these are at the rates that we see with adults. So they absolutely are. We need to address them in terms of how are we going to control this pandemic, but they're not like the elderly who are dying at high rates, or those with underlying conditions, or our essential workers who are forced to be within 6 feet of others and are more susceptible to getting the virus. Our children get a number of different vaccines. It's only a matter of time before we develop the formulations and have accurate dosing so that our children will be able to be vaccinated as well. But it's not as high a priority as making sure that all of our nursing home patients are vaccinated, our essential workers are vaccinated, our teachers are vaccinated. But that I'm sure that will come as well in the next year or so.
Thank you so much for that. So this is actually another one for the health department. So based on all the reporting I've done since the pandemic started in March, I found that every school district has a different reopening plan. Some school districts are letting COVID-19 case rates guide them on when to reopen, like waiting until Fresno County is in the orange or the red tier, and others have open campuses while the county is still under the most restrictive guidelines. What does the county health department advise? Should school districts hold off on reopening until case rates are significantly lower, or is it safe to go back right now?
Dr. Z, you want to go based on the latest guidance we sent
Well,
out?
Sure, I'll start. So, the numbers that we're seeing are incredibly high. So, there's the color tiers, and these not everyone is probably familiar with those. The most, where there's a most widespread tier is called the purple tier. And the cutoff to go from the most widespread to the tier to the next lower level, the red tier, is 8. So if you're at 8, you're still in the purple tier. At our last surge over the 4th of July, we were in the 20s, and it seemed like our case rates were in the range of the 20s, which seemed very, very high. Our case rates recently have been 80, 10 times the rate of that purple range, and that's why we've seen our ICUs overrun, why we're seeing 20 people dying a day. I mean, it's really it's very real what has happened. So what the state has put out recently is said if you can until we get down below a rate of 25, then we should not be opening schools, and that's based on hard science. And the state has recently brought on Dr. Bardock, who's a UCSF pediatrician, to help guide them and to make sure that we're being guided by the science. And so getting it below 25 is really what we're looking for in order to say, okay, let's start to do this. But we at the health department, we are very committed to getting our kids back, and I think all of the Hank and Emer, who we work with closely, right from the beginning, the kids who are in high and special needs children, children with barriers that really needed to have in-person education. We worked very closely with the schools to make sure that these kids were able to go back to have in-person learning experiences, but we want to do it safely. But our bias is to get kids back. But until that case rate gets down below 25, we need to balance the overall risks in our community to that benefit of having more children back in school.
And to be clear, those schools that had the waivers and that had opened up last semester, done safely, they were okay to bring the same number of kids back. We just asked until we get to that lower case rate that Dr. Zweifler said at 25 per 100,000, don't add any more additional students to your phase-in plan until we get down to that case level, because we just want to make sure we're continuing to go down and bring those cases down.
Yeah, Monica, and if I can add to that as well, it's important for everyone to know that across Fresno County, we have nearly 35,000 kids back on campuses at this moment. Small cohorts, students that are experiencing learning difficulties, perhaps foster and youth students. Nearly all of our 32 districts have students back on campus, totaling nearly 35,000 kids. When you hear that certain districts are deciding not to go back until whatever color it may be, those are local decisions that our superintendents and their school boards need to make. Some of them have chosen to, come back later, but now with the new guidelines where we are at 25, the recommendation is at 25. We're nearly at 3 times that rate right now, and that's why this is a community effort to use our mitigation strategies and use those strategies that we all talk about, wearing masks and social distancing and hygiene, because we're all in this together, and we want to get every kid back on campus as soon as we can.
Thank you so much to our 3 panelists for answering that question. And I'm going to throw it back to Isabel now.
Thank you, Monica. I'm going to dive into a few community questions. The first one being from Lisa Eidelheit from Fresno. And this question is for Dr. Zweifler. Why do we keep hearing schools are not vectors for spreading the virus when, according to a study published by Princeton University in September 2020, children were found to be the super spreaders remaining asymptomatic themselves?
Okay, so I would look at it as a relative issue. So kids can and do get the virus, and they can spread it. That has happened, and as the study referenced indicates. However, they are at considerably lower rates. So if you go to community medical center and go to their ICU, you will see it overrun by COVID patients, and they're elderly, they're people with diabetes, they're people with heart disease, or people with obesity. If you go to Valley Children's Hospital, you will not see children. It would be a very rare child who is there with COVID. So the reality is that kids do not get as sick from this as do adults. And but can they spread it? Yes, they can. Can they get sick? Yes, they can. Are there immune kind of responses that can cause long-term issues? Yes, you can. So we need to be careful. And as Hank mentioned, what does that mean? That means all of us need to be wearing a mask, socially distancing, doing the screening, and being careful about being in large groups. And so it's, at the same time, education is so important for our children. The psychosocial benefits that they have from being around children are so critical. So we try and weigh that. We're in this situation now where we're in this terrible surge. We're starting to see it lighten up. So I think there's light at the end of the tunnel. We've seen very consistent patterns where it's related to holidays, where people are getting together. So that's a message for all of us to try and not do that, to fight against that, and particularly as we get through this surge. But as we get through the holidays, and the other big thing that's going on is that we're getting the vaccine out to some of the most vulnerable individuals. And that's happening too. So it's been healthcare workers, our skilled nursing facilities, some of our essential workers, our first responders are all getting vaccinated, which is really, it's just so positive and encouraging. And just as a side note, it would be so to really encourage everyone who's listening to, when your turn comes up to get the vaccine, to get that vaccine, and to advocate to your parent and your loved one that they too get that vaccine. If you are not vaccinated, your chances of getting COVID are 20 times as high as someone who is vaccinated. And so it's beneficial for you. You're less likely to transmit it to your friends and neighbors. And you're helping to drive down case rates in our community so that we can do things like open up our schools, open up our restaurants and our gyms, all the things that we want to do. The vaccine, we really don't have effective treatments. The vaccine is the only effective tool we have to get out of this pandemic. So I feel so strongly that all of us really think of it, even if not just for ourselves, for our communities and our loved ones. It is something that we should be doing. There are no known contraindications except for having an allergic reaction to the vaccine itself. So it's really something that all of us can and should do to get through what has been the hardest period, I think, in many of our lives. How are we going to get back to normal? It's going to be to get that vaccine. So that vaccine is rolling out. I think we're looking at a much brighter day, around the corner. It's a little bit murky because of these variants that are popping up. But the reality is that as we get more of our most vulnerable populations vaccinated, it's going to give us a much more leeway to open up schools more fully. But even then, we're going to want to continue doing what we've been doing in terms of socially distancing, wearing our masks, so we can keep this under control.
Thank you. This next question is for Hank. It's for Hank Gutierrez, but it's also a question that Imra Farrell might have some more insight on. This is from a parent named Amy from Clovis. If we have a waiver, why can't children in 3rd grade and under be back in the classroom?
So again, I'll speak to that really quick. Again, local districts under their local control with their school boards and superintendents have decided which grade levels right now regarding their available space, staff, what is the safest route to go with the number of students to have on campus. So again, every superintendent, every district has local control over that.
So I'll chime in, Isabel. So yes, in Clovis Unified, we have 34 elementary schools, and all of the schools in our district have an elementary waiver. So we have students in all grade levels, TK through 6 at every elementary school in the district. So I'm not quite sure of Amy's question in terms of if she's thinking that students can't be in school if we have the waiver. Basically, for us, we surveyed all of our parents back in early October and determined which parents wanted to send their children to school for in person. And we brought back all of those who wished to come before the winter holidays, that actually I will say the vast majority. And then we had about 2,300 additional students who had opted or were scheduled to continue the phase-in right after the winter holidays. And of course, right now, we're in a holding pattern for those students at the elementary level because of the order from the Department of Public Health regarding not bringing additional students back.
Thank you. I'm sorry.
Well, I was going to say people need to bear in mind that because we surveyed those who wanted to come back. So just to give you an example, we have about 22,000 elementary kids in the district. Right now, we have about just under 10,000 of them in the classroom on a daily basis in a hybrid model, Isabel. So it's a lower number of students in the classroom, and it obviously that makes it very optimal conditions for us to be able to make sure that we are implementing all of the safety procedures that are in our waivers with absolute fidelity. So that's a big piece of the puzzle right now, is that we have about 10,000 in our elementary schools and with another 2,300 asking to come back. And so we will ultimately have about 12,000 of our elementary students who have opted to come back for in person once the Department of Public Health conditions are met, which is currently at 25 cases per 100,000.
Thank you so much, Dr. O'Farrell. This question is actually also for you, Superintendent O'Farrell. It is from a parent called Calvin Fleming from Clovis. And his question is, I'm a CUSD parent to 2 elementary school kids, 4th and 5th graders. If schools are allowed to fully reopen this school year, will parents have a choice to continue to do distance learning through June if they live with relatives that are at high risk?
Yes. The answer to that question is absolutely yes. We have many, many families, Isabel, who for a variety of reasons will want to stay with distance learning, and we will be giving that option right through the school year so that we can, continue to meet the needs of families such as that caller who has obviously somebody in the home that they are concerned about.
Thank you so much, Dr. O'Farrell. This next question is for Hank Gutierrez and is from Gilda Zarate Gonzalez from Fresno. How do we track which school ventilation systems have been updated and meet the criteria to filter viruses and particulate matter? Who will be enforcing that schools meet the standards recommended?
That's a great question. And again, that goes back to our local school districts. So if the caller is a Fresno Unified parent, she would reach out to the school principal, and the school principal would be able to articulate what health matters and what ventilation has been updated at the school site. We're all working hard to do a lot of those particular strategies. So I would advise her to first get in touch with her school site.
Thank you, Hank. This next question is also for you. It's from Sarah Quiggle from Fresno, California. What protocols are there in place as far as classroom size, lunchtime, recess, or gym? Will the students still be practicing social distancing?
Yes, they're all safety strategies and all social distancing strategies are housed at the particular school site. Every superintendent has mandated that their schools have mitigation strategies with regards to whether that be distancing desks 6 feet apart, plexiglass in between the desks, and that goes for small cohorts out at recess so that students are distancing even out in the playground, and definitely utilizing whatever good weather we have for lunchtime. Kids would be eating outside, distanced, so that again, it's another layer of a mitigation strategy. So I would use the Swiss cheese analogy where you have holes in the cheese, and if you stack 10, 12 pieces of Swiss cheese on top of each other, pretty soon those holes start to go away. And that's the best analogy I can use for what's happening on our school sites now, and even when we get to a safer place to add more students onto a school. So starting with wearing a mask, the biggest issue we're seeing is that when kids are allowed to, the kids that are currently allowed to attend school, the biggest thing we need partnership with our community members and parents is that if there are symptoms being shown, please contact the school and keep your child home. The best thing we can do is to keep children home that are showing signs and symptoms so that they aren't on the campuses, even in the small numbers we have currently.
That's great. Thank you, Hank. I really appreciate that. I'd like to move it back to Monica for a couple of questions she also has. Monica?
Thank you, Isabel. So this next one is going to be for David Lucchini. A big question and concern I've been hearing from teachers in Clovis and Fresno is about contact tracing on school campuses. So how are school districts able to pinpoint where a positive COVID-19 case started, and how do you make sure that virus isn't spreading to the rest of the campus?
Yeah, that's why I go back to that academic setting medical investigation team that works very closely so they could figure out where they may have gotten exposed to the virus and make sure we're implementing stuff to stop the transmission. That's always the goal with the infectious disease team, is how to stop transmission of virus, right? In any infectious disease we work on. So that's where they work very closely with the lead person on the school to work on this contact tracing, see what information they're getting from them. And it's very important as the contact tracers are interviewing folks who have been in close contact with someone or who was sick, is to make sure they're very open about where they had been in contact with people in the past several days and things like that, so they can get the best information. Remember, if you don't get good information, it's really tough to come up with an idea of where the exposure may have occurred. So it's really critical to provide good information to the investigators.
And I can just add one point to that. The other is if we can make sure that all our kids are 6 feet apart, socially distanced, that makes the contact tracing job so much easier and reduces the likelihood of transmission. Emer mentioned the hybrid model, and that really is, I think, the cornerstone to help us do this. So it enables us to have smaller class sizes while still providing the educational material. So we really want that in-person learning for the kids, for their psychosocial development. But there's a lot that can be done with distance learning. And I just like the ability for us to have this webinar today is because we have this kind of digital capability that I think we can and should continue to use. Having smaller class sizes for our kids so they can have that individualized attention has some real benefits as well. But I think an absolute cornerstone of our preventive measures is maintaining social distancing, maintaining that 6 feet apart. And that's dependent on smaller class sizes and a hybrid model. And so we really see that as a critical element in making sure that we can open our schools safely.
Yeah, and kind of going off with what you were saying about, it's important that students keep 6 feet social distance. I wanted to ask you, Dr. O'Farrell, what are the challenges that go with that in making sure kids are 6 feet apart? What have you been hearing from teachers? What are some challenges and maybe some, more creative ways they found to make that kind of work, this new type of classroom setting?
Well, yes, actually, Monica, I've been out to many of our schools, maybe at least 10, 12 of our schools over the last couple of months. And the first thing I'll say is it's very impressive to see how well our students and our staff, but I'm particularly talking about our students who are young kids, are wearing their masks, even young preschool students with autism, wearing their masks and not handling their mask, being very diligent about keeping their masks on. I've noticed students being very diligent about the 6-foot distancing. All of our schools have traffic flow patterns throughout their entire campuses with marks on the ground to show our students where they can line up and how they can stay apart. They have times where they can go out to our large grassy areas and they can run around way out on the grass and be able to get the wiggles out, so to speak. But during classroom time, when I've been in classrooms, I have to say I'm very impressed that children are very well able to follow the rules. And our teachers are doing such a great job. Obviously, we have a lot of teachers in our schools right now. They've done a great job training all of our kids. They phased in the return of students to school so that they could do a training, a proper training of not only for themselves, but also for our kids. And they've had to train all of the parent communities at different school sites too, because I've been out there when parents are dropping off and picking up, and there's a whole plan for that as well. So it's very possible to do when there is a very good plan in place. And we've taken it very seriously in Clovis Unified. We really have, since we started, and we have about 730 special ed students on campuses. As I mentioned, there are almost 10,000 elementary, and we have 1,300 secondary students on campuses too. All of these students have been there since before the holidays. With all of that, and also with all of our students who've been coming on for athletic pods and other co-curricular pods, we've only had 303. I actually just got the number before I came on, so I could be completely accurate. 303 cases of COVID of that group, of which we estimate is about 20,000 people. And I do believe it's because of our adherence to, what Dr. Zweifler was just saying, to all the different protocols. We've had one program since the end of October, since we started bringing kids back. We've had one after-school program that did have to shut for a short period of time because we had some staff members interact with each other outside of the workday, and that created a situation where our Department of Public Health felt we needed to shut that program down. It was an after-school program. Other than that, we've actually had no programs shut down, and every decision regarding shutting down any kind of program or any class is ultimately made by the Department of Public Health. We have a whole team of contact tracers that were trained many months ago through our nursing department, and we have nurses and health aides across the district who are very well trained and are working with our district personnel to make sure that all of the appropriate paperwork is completed every time there's a case. So it's a very well-oiled machine at this point.
Thank you so much, Dr. O'Farrell. And so this question is for the health department. How many positive cases need to happen before a school shuts down? Does each school district decide, or does the county make that decision?
We like to work with the school district. The state considers an outbreak, I think 3 cases over a 14-day period, but they've given some guidance on when to consider shutting down a school. Like if you have 5% of all these students are on campus and the staff on campus, if there's a 5% of cases to consider shutting down the school. But we really like to have the discussion with our academic setting medical investigation team working with the school, and then they consult with the health officer or Dr. Zweifler for further guidance. It's really a case-by-case scenario.
And so far, has there been a school that has had to shut down in the county?
No, we've not hit that 5% or any of those guidance where we've had to shut down. Like I said, there's been an instance where a school decides on their own just to be safe because of concerns they thought, for the parents and staff to shut down, but we didn't push them to shut down the whole school for that.
Thank you so much for that information, David. And then throwing it back to Isabel.
Thank you, Monica. So I'm going to move on to our next section, equity in Fresno education. And I also want to get to some live questions before we end. We're almost at 40 minutes. So Gavin Newsom recently revealed his plan to bring all students back to school. He was hoping to do that in February. And that plan was highly criticized by the state's largest school districts, including Fresno Unified, because they say it overlooks the concerns of spread of COVID in high poverty communities. COVID spread has also become a point of concern for teachers. Monica recently did a story on how Clovis teachers are currently feeling about returning to in-person learning. I'd like to pivot back to Monica for a question that she had, and then we'll go back to some more community questions.
Thanks, Isabel. So this question is for Superintendent O'Farrell. So we've heard from Clovis Unified that an overwhelming number of teachers would like to return to campuses. But I've also spoken with teachers who say many don't feel safe or comfortable returning. Teachers we've spoken to say the district is, quote, rushing to reopen classrooms before it's safe, and would like to know why many teachers are being required to work on campus, even though they don't have any students in their classrooms.
Yes, well, we do have many teachers. Most of our teachers are in their classrooms working, whether they are in person or, for example, most of our secondary teachers actually do not have students in their classrooms, are working in a classroom administering or teaching via distance learning. The question you're asking is, why would we require our teachers to work in the classroom as opposed to at home? We feel that it's in the best interest of our students and our campuses to have our teachers on campus. It enables our administrative teams to support our teachers. It enables our teachers to utilize the resources on our campuses. And it also is going to be part of our ability to train our teachers, just like we did with a large number of our elementary teachers, in all the different procedures and health and safety procedures that have to be in place as we bring our students back on campus. So having our teachers in their workplace there are a number of reasons why we feel that that's in the best interest of our students. We do have some teachers who are currently working on a remote working agreement because of their health conditions. And we have met with many teachers who have requested an interactive dialogue through our HR department to talk about their health conditions. And we've been able to put into place a wide range of accommodations for those teachers. I've actually seen it up front when I've gone out to school sites. I've witnessed, recently I was at a school and one of our teachers is pregnant, and her colleagues opted to take the in-person students, and she is teaching the students via distance learning who opted for distance learning. At another school, I noticed that we had a teacher who had health conditions and is teaching out in one of our portables, which gives them greater privacy and a sense of distance between him and other people on the campus. So there's a wide variety of accommodations in place. Teachers have access to bathrooms and things like that, so that we can meet the needs of our teachers, but also be on our journey back towards getting our kids in our classrooms, which is what we've been able to do with, like I mentioned, many of our elementary students. The first day that those students were on campus was not the first day that their teachers were on campus.
Thank you so much, Dr. O'Farrell. Isabel, throwing it back to you now.
Thank you, Monica. This next question is for Hank Gutierrez from Sal Juarez from Tulare, California. And he asks, how has the safety of teachers and staff been addressed to assure safety for all with kids returning in person? Is the school district liable if a teacher or staff member contracts COVID at work? And he also asks, what happens if teachers or a staff refuse to get COVID tested or take the vaccine?
So all of our districts in Fresno County have what we call school reopening plans, and every single school reopening plan addresses the safety measures taken for both staff and students. Obviously, if a teacher contracted COVID on campus, or they suspected they contacted COVID on campus, we would get our health department involved, and we would try to investigate the occurrence on that personal level. But all of our districts have schools reopening plans. They've been updating them, in fact, since early April, with the latest mandates and the latest guidelines given to us from both the State Department and the national safety measures. So all superintendents, all site principals are responsible for adhering to those safety guidelines.
Thank you, Hank. And this other question actually is also for you. It is from Sade Williams from Fresno, California. And Sade asks, families are facing many hardships and are limited with their resources regarding the digital gap, especially during this pandemic. What are the plans for supporting our parents who are shouldering great burdens with complication of barriers that are impacting the education of their children?
Yeah, absolutely. That's a great question. And so back in early March, when we first went to distance learning, in mid-April and into May, that's when we made some decisions to make sure that every kid, every student in our county had access to the internet. Then when we moved into our hybrid models and our cohort models, those are the particular students that we allowed to come back on campus for a priority basis because perhaps they did not have internet connectivity within their household. So for a particular parent who's experiencing a digital gap, so to speak, I would really encourage that parent to call their school site, and perhaps that child can be embedded into one of our cohorts, because what's happening is when a child is allowed to come onto the campus in the small cohort, then they're able to access the internet provided by the district.
Thank you, Hank. This question is directed to David Lucchini. So there is conflicting research on the safety of opening schools. We received several questions referencing recent studies that say in-person learning is safe and other studies that say in-person learning is not safe. Do you have any advice for parents to make sense of this conflicting data, and is it safe?
Conflicting, that is the theme of COVID 2019. Always something conflicting. I think Dr. Zweifler covered a little bit too. The plans that we've seen, especially with the waivers, if those are implemented perfectly, we've shown that it's very, the transmission on campus has been very low when following those plans very well with the distancing and the masking and all that. Going back, and we've seen this, I think there was a question somewhere from one of the viewers about, seeing other states, but we've seen other states try to go back to normal, and then boom, there's a lot of cases and they got to shut down. And that's some of the stuff that the state wanted to avoid, is schools opening, closing, come up with a way that's a little more consistent so there's not as much disruption. And so once again, based on what we've seen with our experience here, when the schools followed their plans correctly, it went pretty well. So Dr. Z, anything on your end?
Well, I think it just highlights that there's just no absolute black and white ways to frame this. So if we really wanted to be 100% safe, we would all say locked up in our rooms all day. And I don't think that's really acceptable to most of us. On the other hand, if we throw off our masks and go to the Super Bowl, we're going to have literally millions of Americans who are going to be dying. And that's not acceptable either. So, we have to operate in that zone where there's some conflicting information. But again, going back, we do know that kids can get COVID, they can transmit it, but it doesn't happen as often. And if we follow our basic protocols with the masking and the social distancing, that takes us a long ways in terms of reducing the risk of spread. And so you were starting to talk about equity issues. The impacts, psychosocial impacts. Hank mentioned some of the efforts that have been made to kind of prevent inequities. But what we see consistently, not only in schools but throughout our society, the rich get richer. If you've got the money, you're going to make sure your kid's got a tutor, they've got some help, and even if you're not home, you're going to have someone else. Maybe they put them in a learning pod that you pay a teacher someone to come and help your student. Schools are really a great equalizer in our society. So whatever we can do to support our schools is of critical long-term importance in addressing some of the social determinants of health and addressing health disparities in our society. So I think that's a factor that we need to consider when we're talking about these issues. We certainly want to do it safely. That's why right now within the surge, this is not the best time to reopen. We've really, as we said earlier, we've really have encouraged the schools to try and open up safely with small cohorts, targeting those that most need it, developing those hybrid models. So when you need to go to distance learning, you have that capability and you have that be able to offer that to your families that are nervous about going back. We absolutely should have that. But there's a lot of kids who need that in-person support as well. And so in order to do that, you've got to use a hybrid model, smaller class sizes, social distancing, et cetera. But just looking at it in a really kind of black and white way, I think really obscures some of the larger issues. And just for us in public health, it's not just about COVID; it's about overall health of our children and our society. I think we need to factor all of that in, which is why we want to look at ways that we can get kids back, but we want to do it as safely as possible. And just one other comment about the kids, it's and the kids wearing the mask. Emer was mentioning, how well the children are doing, and what a neat opportunity for our kids to say, children, you get a chance to help save lives in our community. You are part of the solution. You are going to by wearing masks and maintaining social distancing, you are contributing to our society. As a little child, what an empowering message for our children. And for us as parents to be role models for that, to say, this is the way we get through this, by acting responsibly, by taking these measures that we know reduce the spread. We haven't, really gotten back to the basics. COVID is a respiratory illness. It's spread by when you talk, when you sneeze, when you cough, when you breathe. That's how it's spread. That's why putting on a mask is so important. That's why social distancing is so important. That's why you're much better in outdoor settings. So yeah, teaching these kids these basic things are some really important life lessons that I think can come out of this, and we can do it in a safe and effective manner.
Thank you,
Dr.
Zweifler.
I'd like to piggyback on Dr. Zweifler's comments, if I can, Monica. I just want to let our viewers know and our readers know that Jim Jovino and the Fresno County Superintendent of Schools, to this date, we've come alongside our superintendents, 32 districts, faith-based superintendents, charter school superintendents, as thought partners and advocates and strategists, thinking outside of the box whenever we can with regards to mitigating this virus. To date, we've distributed 1.6 million face masks. We have another 1.1 million face masks and N95s, face shields on the way to distribute to our districts. To date, we've distributed 15,000 gallons of hand sanitizer. We have another 1.5 thousand thermometers on the way and about 8,000 nitrate gloves on the way, just to keep this virus at bay on our school sites. And so that's why I mentioned earlier, we're all in this together. Our metrics right now are off the charts. We're nowhere near where we need to be, but we're doing the best we can. We're providing mental health services. I saw a question in the chat about teen suicide. This is something we take extremely serious. If you go to our website at allforyouth.fcoe.org, we have strategies. We have behavioral health opportunities for families to reach out. Again, that's all and the number 4 youth.fcoe.org for mental health services. We know how serious social isolation is for our students, and we're tackling this head on. But we have to go by the metrics. We have to go by the data that shows that right now, on a mass scale, sending all students back to campus is just not ideal at this moment.
And the metrics includes looking at our healthcare system, and our healthcare system is overwhelmed. Our hospitals are full. And we're sitting out there trying to find more staffing from the federal government or from the state, or, and we're competing with other counties or other states to find the staffing to get into our hospitals. That's a critical sign. this hospital system has been going overload for several months. I hate to bring up it in a meeting, but we've had to in the last couple of months go out and purchase more refrigerated trucks for some of the bodies that have expired due to COVID. So this is serious stuff that we're dealing with. This is not normal. This is not a normal flu season when we're talking about these things. And our job is to really do the best we can to protect that healthcare system and that hospital system.
Thank you, David. We're running low on time. I have about 7 minutes. So I did want to get one question from the live at the very least. And this question comes, it's for Dr. Imo Farrell. And if you could do it lightning round in 1 minute answer, that would be great. It's from Chelsea McHugh on YouTube. She asks, what about the kids who are in special education at CUSD who need to return in person as soon as possible for their well-being as well to receive a proper education?
Yeah, well, all of our programs in our special day classes, all of those programs have been back since the end of September. So as I mentioned earlier, we have about 730 special education students in person every day. We do have some RSP students, and perhaps this lady is talking about a child who's RSP. And depending, RSP students were given the opportunity to come back also if parents opted for that. And if they came back from before the holidays, they are in our classrooms. Right now, anybody in Clovis Unified who has asked to come back, we want them back. We are waiting for conditions to improve so that we can actually have permission to bring them back. And so we're ready to bring back her child, if her child is an RSP student, as soon as the conditions allow it.
Thank
That's
you.
the shortest I can get it.
Okay, and so we can do one more lightning round quick question that's a minute long. It's from Angela Rogers. She asks, what about the kids that are failing now? My daughter was an AB student in 6th grade, and now in 7th grade, she has Fs. She has never had an F in the 7 years of elementary school.
Yes, and actually we've been monitoring the academic progress and also the attendance of our students, and we recently presented some reports on that to our governing board. And I will just tell you, even as great as our teachers are doing in terms of distance learning, we're experiencing between a 4 and a 5% increase in students failing across the board in our district. And we do feel it's because they're not in the classroom. Not every child does well with distance learning. It's hard to totally engage children who are opting to not be engaged, and it has been a real challenge. Even though we have teams of people visiting homes, connecting with kids, engaging with parents to get their kids more engaged, it is just flat out not the same as having kids in the classroom, which is one of the reasons we're really pushing to get our kids back in the classroom. And she's right. There are many kids who've never gotten a D or F before who are experiencing that right
jobs.
now.
Yeah, to get the case rate down, we all need to be wearing masks, socially distancing, doing our part, teaching our kids that. That's what's going to get the case rate down so we can then move on. That and getting vaccinated. We're going to get through this surge. It's going to be a better day. But it's up to all of us as a community to bring those case rates down so we can get our kids back in school.
Thank you, Dr. Zweifer. And I did have one question that has to do with athletics. It's another lightning round because we have like 3 minutes left. And it's for Hank. If you can you please explain the difference between the Fresno order and the state order and how that affects school athletics, and if kids can participate in outdoor athletics, say like track and field?
Absolutely. So this question is directly in concert with our Fresno County Department of Public Health and our local CIF athletic department. So Dave and Ryan Toss, the CIF commissioner, are working concertedly with regards to I would say we've made great shifts to align sports with the colored tiers with regards to our metrics. Right now, we're unfortunately in the purple tier. We're very much in the purple tier. And a lot of the sports you'll see aligned in the purple tier are outdoor sports where perhaps social distancing and the open air can help. But again, we're concerned more with getting kids back in the classroom and getting our case rates down and our metrics down before we can worry about getting kids to play sports. Philosophically, I'd rather have kids in the classroom than worrying about sports right now.
Thank you. Thank you, everybody, for participating. Thank you, everyone who submitted your questions. I'm sorry we're not able to get to all of the questions. We had a lot of really great questions, a lot of great responses. This has been a really insightful conversation, and thank you all for tuning in. The Ed Lab relies on donations. To learn more about how to donate and how to support our work, you can visit fresnobee.com/edlab. And also be sure to find us on social media. Our DMs are always open. You can, and we're always here to chat. You can follow me on Twitter at Isabel S. Dieppa, at Monica Velez at Monica Velez21, and the Fresno Bee at Fresno Bee. I want to once again give a thank you to all of our panelists, and thanks again to everyone for tuning in. Until next time.